Back pain treatment. Every year, more than 65 million Americans suffer from back pain. The condition is extremely common and one of the leading reasons why people seek medical care. Besides the obvious pain that comes with it, back pain is also highly inconvenient. It can disrupt your work, routine, and daily activities. Some people suffering from back pain find that they will have to forego indulging themselves in recreational activities like sports simply because it would put too much stress on their back. Others are in so much pain that the simple task of standing up becomes an impossible feat. Fortunately, the recent advances in medical science, research, and technology have opened up numerous back pain treatment options for people who suffer from this condition. How these back pain treatments affect the patient's back pain varies from individual to individual, so that care is advised when choosing the right form of treatment. Below are some of the more common back pain treatment options you can choose from. Drug therapies.
There is a wide variety of drugs to choose from, including pain relievers, anti-inflammatory medications, and relaxants which can ease muscle tension and spasm.
Several of these drugs are available over the counter without need of prescription. However, since some of these drugs may have side effects, it is advised that you consult your doctor before taking any of them. The drugs used as back pain treatment are classified as follows. Non-steroidal anti-inflammatory drugs NSAIDs, including aspirin, ibuprofen, naproxen, ketoprofen COX-2 inhibitors, such as celecoxib acetaminophen, Tylenol, anisin 3, phenaphin, Valadol, and other analgesic medications opioids, such as morphine and codeine muscle relaxants, cyclobenzaprine, Valium, carisoprodol, etc. Chiropractic manipulation. This form of back pain treatment requires manual manipulation by a professional therapist or a chiropractor or other qualified health professional. The therapy is thought to help relieve back pain by taking pressure off sensitive neurological tissue, restoring blood flow and increasing blood flow. In addition, chiropractic back pain treatment could trigger a series of chemical reactions in the body, releasing natural pain-killing hormones like endorphin. Epidural injections. This is another form of back pain treatment that is considered as passive since the therapy is applied to the individual. In this method, steroids are injected into the spine. As the drugs travel through the entire spinal column, inflammation in the painful area is decreased, thus providing relief. Massage. Massages are therapeutic back pain treatments that provide pain relief in the lower back. The manual manipulation of the muscles is said to improve the blood flow, which in turn results in reduction of muscle stiffness and range of motion increase. Sometimes, the massage may also trigger the body to release endorphins, which are the body's natural painkillers.